Welcome to Bones Anatomy. I'm gonna go through the muscles of the lower limb today. First of all, I want to emphasize that every model is different. Every individual is different, so there are so many anatomical variations. So depending on the data they choose, lots of textbook or publishers are saying slightly different things. So if you're students who's taking an exam, I recommend you to stick to the main textbook. And when we study the muscles, I think it's very important to understand the logic of nomenclature, how the muscles are named by. So the logic I use is function, attachment, and description. Those are very descriptive. Let's take an example. If we see the muscle that extends the toes is digit and extend means extension. So we're gonna name as a function extension. Attachment, toes, which are digitorum. Description, there are two. There is long and short, and I'm gonna take the long one this time. So it's gonna be named as extensor digitorum longus, which means toes extensor, which is long one. All right. And muscle action can be varied depending on the posture and combination of other muscle alignments. Right, the first muscle we're going to cover is iliacus. It means near around the ilium. And this is a prime hip flexor, not the rectus femoris, iliacus, and psoas major, which are going to build up the iliopsoas. Iliacus, innervated by femoral nerve, originating from the iliac fossa, as in name gives by, inserts into the lesser trochanter, and action, hip flexion. Psoas major is a large muscles on the loins. It innervated by anterior rami of L1 to 3, originating from the posterior abdominal wall, which are mainly lumbar vertebrae, inserts into the lesser trochanter, and thus hip flexion. Psoas minor is very small muscle and it is very tendinous, and most of the case it is quite difficult to see on the cadaveric model. Innervated by anterior ramus of L1, originating from the vertebral body of T12 and L1, and inserts into the iliopubic eminence and or pecten pubis. Action is very weak assistance in trunk flexion. Tensor fasciae lata. It means band tensor on the side. The band we are talking about now is the iliotibial band. So innervated by superior gluteal nerve, same as gluteus medius and minimus, originating from the iliac crest and inserts into the iliotibial tract of fascia lata. And it's going to stabilize the knee in extension. Adductor magnus means great drawer to the midline. It is so huge, have two parts. Adductor part innervated by obturator nerve, but the hamstring part is innervated by the sciatic nerve of tibial division. Adductor part originating from the iliopubic ramus inserts into the posterior femur, linea aspera, medial supracondylar line, mainly more on the femoral shaft to give the adductor function. And the hamstring part is originating from the ischial tuberosity, inserts into the adductor tubercle, which is quite weird because adductor part does not insert there, but the hamstring part inserts into the adductor tubercle. And the action is a bit different as well. So adductor part, we're going to do the hip adduction, flexion, and external rotation. But the hamstring part, as in name gives by, is going to functioning as hip extensor and internal rotation there. Pectineus means the comb for your hair, and mainly innervated by femoral nerve, but can also have innervated by obturator nerve as well. Either going to originate from the pecten pubis of the iliopubic ramus and inserts into the pectineal line of the femur, and either functioning as hip flexion as leg flexion. Adductor brevis, short drawer to the midline. This is shy younger brother of the adductor longus. So in the model, you have to reflect the adductor longus to see the brevis. Innervated by obturator nerve, originating from the body of pubis and inferior pubic ramus that inserts into the posterior surface of proximal femur, upper 1/3 of linea aspera. You're going to functioning as hip adduction and internal rotation. Adductor longus, longer one, and older brother of the adductor brevis. Innervated by obturator nerve, originating from body of pubis, inserts into the linea aspera or middle 1/3 of femoral shaft. Action is the same. Gracilis means slender, the slender man. It also innervated by obturator nerve, originating from pubis, inferior pubic ramus, ramus of the ischium, and inserts into the pes anserinus, which means goose foot, with sartorius and semitendinosus. Now we move on to the quads. We have rectus femoris and 3 vastii. All 3 vastii is pretty much same, but have a different origin. So let's start with the vastus medialis, means great one on the middle, innervated by femoral nerve, originating from the medial intertrochanteric pectineal linea aspera and supracondylar line. Inserts into the quadriceps femoris tendon through the patella, and the action would be knee extension. Vastus intermedius means great one in between, originating from the femur, upper 2/3 of anterior and lateral surfaces. Vastus lateralis, great one on the side, originating from the lateral intertrochanteric gluteal tuberosity linea aspera. Rectus femoris, I call this one as a Bobby and 3 Musketeers because Bobby is special. How special? So this one is originating from the anterior inferior iliac spine, which is crossing over the hip joint line. So it also functioning as a hip flexor, which all the other quads are just knee extensor. So this one is special, which means straight one on the thigh. Sartorius is called talus muscle because talus are sitting in that way, and the function is exactly the same. Hip flexion, abduction, external rotation, and leg flexion, internal rotation. It originates from the anterior superior iliac spine and inserts into the pes anserinus. Obturator externus. Now we are looking at the posterior side, and I'm starting from the deepest structure when we see the posterior view. It means outside the obturator foramen, and obturator means stopper. Innervated by obturator nerve, originating from the external surface of obturator membrane, inserts into the trochanteric fossa, and this is hip external rotator. Quadratus femoris means square-shaped one on the thigh. This is hip external rotator and innervated by nerve to quadratus femoris. Originating from ischium just lateral to the ischial tuberosity, insert into the quadrate tubercle on the intertrochanteric crest, and the action is hip external rotation. Obturator internus. Different to the externus, it originates from the deep surface of obturator membrane and also means inside the obturator foramen. Innervated by nerve to obturator internus. Inserts into the greater trochanter. Action will be hip external rotation and abduction. Gemellus inferior. Gemini means twins. We have 2, upper one and lower one. Innervated by nerve to quadratus femoris with same as quadratus femoris. Originating from the ischial tuberosity, inserts into the greater trochanter. Action is the same. Gemellus superior, twins on the upside, originating from the external surface of ischial spine, all the same. Piriformis, piriform, pear-form, pear-shaped, piriformis, innervated by spinal nerve S1, S2, originate from the anterior surface of sacrum between anterior sacral foramina. Rest of it is the same with other hip external rotators. Gluteus minimus means smallest buttock. On the cadaver, it will be quite difficult to see because we have to remove certain portion of the gluteus medius. If you see the ilium, the bone itself, there is a more chance it is gluteus minimus. If you don't see any of the bony part, it will be just medius. Innervated by superior gluteal nerve, originate from the ilium between inferior and anterior gluteal lines, inserts into the greater trochanter, hip abduction, internal rotation. Gluteus medius means middle buttock, same as gluteus minimus and tensor fascia lata, innervated by superior gluteal nerve, originate from the ilium between anterior and posterior gluteal lines. Rest of information is the same. For this one, you can check with the Trendelenburg sign and we can discuss later. Gluteus maximus means greatest buttock, like a movie Gladiator. Maximus means the greatest one. Innervated by inferior gluteal nerve. If you have a closer look of the gluteus maximus, actually it is lower to the gluteus medius and minimus, so it does make sense, innervated by inferior gluteal nerve. It's quite big muscle, so origin is quite fast. Ilium, erector spinal fascia, sacrum, coccyx, sacrotuberous ligament, inserts into the iliotibial tract, tensor fascia lata, gluteal tuberosity. Action would be hip extension, external rotation, abduction, and stabilizer of the lateral. Hamstring group, biceps, femoris, is very important to understand the logic why the muscle is named in this way. Bi means two, bicycle. Ceps, cephalad, head. Femur, thigh. So there was an anatomist who found the muscle and he wanted to describe. Oh, I found the muscle with two heads and it is on the thigh. So we named it as biceps femoris, innervated by sciatic nerve. It differs between long head and short head. Long head, tibial division, short head, fibular division. Long head originate from the ischial tuberosity and short head originate from the lateral lip of linea aspera. And both of it inserts into the head of fibula. Action would be hip extension, lateral rotation, and knee flexion and lateral rotation because it is on the lateral side. Semimembranosus. Semi means half, and we have two half of it, so semimembranosus and tendinosus. And this one gives a membrane to it, so we call it semimembranosus. Innervated by sciatic nerve, tibial division, originate from the ischial tuberosity and inserts into the tubercle of Gerdy. Action will be hip extension and medial rotation. Knee flexion, medial rotation because it is on the medial side. Semitendinous, same as semimembranosus, it is on the medial side. And this one is tendon-like. It have a long tendon that inserts into the pes anserinus. Originate from the ischial tuberosity. Action would be hip extension, medial rotation, knee flexion, medial rotation, same with semimembranosus. Thank you for listening. Your comment, likes, subscription would be greatly appreciated. Have a good day. Bye.